bloodstream, and then it achieves its endpoint where it goes into the red blood cells or other organs where it exerts its own effect. Whereas with triglycerides, you have the omega-3s that go into the lymphatic system and take a much longer route before they actually get to the final distillation if they find their correct spot eventually. So that is those are the three main components that you have in Neptune krill oil. We have the phospholipids, the omega-3s, and the esterified astaxanthin. This is just to show our production facility, which is found in here in Quebec. And as I said, our capacity has reached 130,000 metric tons. And in light of our partnerships with Bayer and some big companies, as well as our partner Biomed, we see this production to be increasing to up to 500 metric tons within the next 5 years. I will probably just skip through this very quickly, but just to make you aware of the three different families of patents that we have. We have a composition of matter family that protects the actual composition of the oil, and then as well a second family of the method of use, which protects the applications of where the oil is being applied, and then you have a protection of the process patent, which protects the extraction of the oil from the species. And then you also have all our regulatory approvals. As you can see, we are approved regulatory worldwide in the US, in Australia, in Europe, as well as in Canada. So let's talk science now. Let's get into the clinical studies. And this is where you will start seeing why or how this product is so much more superior than fish oils and how it does that. So the first clinical study that we conducted is the hyperlipidemia study, and it was a double-blind, placebo-controlled study which looked at a placebo group, a fish oil, and NKO. We looked at all the blood lipid parameters such as cholesterol, triglycerides, LDL, HDL, and glucose. And what you will see is that even though we expected a triglyceride reduction, which is what has been documented in the literature when you look at fish oils. So we were not surprised to see this reduction in triglycerides in Neptune krill oil as well as fish oil. What was unique, or what was surprising and what was exciting, is that we also saw a reduction in LDL and an increase in HDL. Now this has not ever been shown by any other product, because usually you either have a reduction in triglycerides, or, for example, with the statins, there's a reduction of the LDL, but not the HDL. Or, for example, the new Bioresources increase the HDL, but do not decrease the LDL. So our product, NKO, is actually targeting the bullseye of cardiovascular health. It is reducing the triglycerides and the LDL at the same time as increasing the HDL. And you really need to manage these three parameters together to be able to achieve a significant effect. The second study that we did was on osteoarthritis and inflammation. And once again here, these results were very impressive. If you look at the dose, 300 milligrams of NKO, all of the studies that have been done with fish oil so far, and I'm referring to the cardiovascular studies that were done, the cardiovascular study, were done with about 6 grams to 12 grams of oil. Now, as you all might be aware, is that this is very hard for the consumer to consume, and that's why we have a lot of problems with regurgitation and reflux and compliance of consumers or patients taking fish oils. What is unique about NKO is you only need a small dose of 300 milligrams in this case, whereas in the cardiovascular study it was 1 to 1.5 grams. In fact, in the cardiovascular study, and I will go back just to make a point here, we had extended the study. This study was done for 3 months, and after the 3 months period, there was a 2-month maintenance dose period where the patients continued taking 500 milligrams of NKO, and they demonstrated that they had maintained the same health maintained the same levels of effect. This allows us to conclude that even if they had started with a 500 milligram dose at the beginning of the study, they would have achieved the same results. It would probably taken a bit longer. The point here is basically just that I want to make is the fact that it's a small dose. It is not like 6 grams or 12 grams of oil that a lot of fish oil need to achieve the result. So back to the osteoarthritis study. In the top part over here, we have the CRP, C-reactive protein, which is a very well-known inflammatory marker. What you see here is that after 7 days, we are getting a reduction of almost 20% of this C-reactive protein, only with 300 milligram dose. That's a very quick effect and a very, very interesting result, because CRP is known to be a pivotal player in most inflammatory diseases, such as osteoarthritis or even as cardiovascular health. The second part of this slide down here, it was looking at the WOMAC questionnaire. The WOMAC questionnaire, as you may know, is a validated questionnaire to study osteoarthritis, and it looks at pain, at stiffness, and at functional impairment. And once again here, within 7 days, we're seeing a significant reduction of almost 30% in pain, 20% in stiffness, and 22% for functional impairment. So this allows us to conclude that NKO is really effective not only for cardiovascular health, but also for osteoarthritis management and the reduction of C-reactive protein. Once again, this study was done double-blind, randomized, placebo-controlled. And all of our studies have been published in peer-reviewed journals and are available for further reading if you'd like. We could provide you with this information. The third study that we did was on women's health. And here we compared it to fish oil. And you can see that in all of the physical and emotional symptoms, this was also a validated questionnaire that is used by the obstetrics and gynecology, most obstetrics and gynecologists to look at PMS. And over here, after a supplementation of 3 months of NKO, you see a significant reduction in all of the physical and emotional symptoms. Whereas when you look at fish oils, there is no significant results that are seen, except for a few of the physical symptoms that are seen here at the bottom. Whereas with NKO, it is in all the physical and emotional symptoms of this questionnaire. Once again, a superiority of Neptune krill oil is being demonstrated over standard fish oils. The fourth and last of the first, the fourth study that was done back when all of our clinical studies were initiated was done on ADHD. This was a pilot study, so it is not a I would say 100% conclusive study, but it gives us some really interesting indication on some of the effects that are seen with Neptune krill oil. In fact, when we recommend this product, we always say take 2 soft gels in the morning, because a lot of people have noticed that when they take it too late at night, is that they cannot fall asleep because it keeps you awake. And that kind of was the starter of looking at this study. And we looked at ADHD specifically because of its concentration and focus and planning skills that some of these patients suffer from. And when these patients were supplemented for 3 months with NKO and 6 months in blue, you see that there's a significant and positive effect in increasing concentration, in focus, and in planning skills. So, when I first started talking about how the difference between the digestion of omega-3 that are attached to phospholipids in Neptune krill oil is different from the omega-3s that are attached to triglycerides in fish oils, it was something that we have always sort of believed in, and we had known in literature, but we wanted to take it a step further and basically prove it scientifically. And how we do that is by doing a bioavailability study. So this was a more recent clinical study that we conducted a couple of years ago and done in an independent CRO in Germany. And in this study, we supplemented, there were 4 groups. There was the fish oil group, there was the ethyl ester group, the NKO-like blend, and the NKO. Why we put in this NKO-like blend group, it's because over the years there was a lot of questions that were coming back from distributors and consumers asking, why can't we just simply blend a phospholipid that they could get from lecithin, put in some omega-3 that they could get from fish oil, and throw in some synthetic astaxanthin, as I had mentioned, is available on the market. And we put that arm in that study to basically answer that question. It's that it's not simply throwing in these ingredients together that is going to provide this incredible product. It's really all in the bonding and in the process that the patented extraction process that keeps and preserves these bonds between these active ingredients. That is the essential component here. And if you look here at the graph, you'll see the NQO-like blend perform the poorest of all of these compounds. After that, there was the fish oil that performed better than the NQO-like blend, but still less than the NQO. Here we are looking at the EPA levels in the plasma, and down here we were looking at the HA levels in the plasma. So basically, at the beginning of the study, all the patients took 500 milligrams of NQO, and the equivalent of that is the equivalent of 125 milligrams of EPA and DHA, and this was standardized for all 4 arms. So there was 125 milligrams of omega-3s on fish oil, 125 for the ethyl esters, 125 for the blend, and for the NQO, just to show that they had all started from the same point. And the same thing here for DHA. It was standardized for 500 milligrams, and once again, you see superiority of NQO over the 4 other arms of the study. So this was looking at the plasma, and another interesting result that came out of this study was the omega-3 index. As I had said originally, the omega-3s, once they get into the blood, the omega-3, the NQO, the omega-3s found in NQO that are bound to phospholipids, get into the bloodstream and are assimilated differently, and they go into different endpoints. And one of these endpoints is the red blood cells. And once they get incorporated into the red blood cells, this improves the omega-3 status of a patient. So the omega-3 index is this new cardiovascular disease marker that a lot of cardiologists use to assess the risk of developing cardiovascular heart disease. And the higher this index, and it ranges from about 4 to 8 normally, but it could go much higher than that and lower. But the higher or closer you are to 8, the less risk you are at developing cardiovascular disease. So here we had shown that NQO performed the best when it came to improving the omega-3 index, and the blend and the fish oils as well as the ethyl esters did not work as efficiently as the Neptune krill oil. I put in this table in here to basically summarize everything I said, so I will not spend too much time on it. But here are a compilation of all the numbers that I just spoke about: the hyperlipidemia study, the arthritis, the MS study, the ADHD study, and the bioavailability study. But in addition, I have added another factor here, or another 2 columns to basically compare them to other fish oils on omega-3 esters and other krill oil products that are found on the market. And as you can see, all the other krill oil products right now, and yes, in fact, there have been some recent publications coming out from competitors where they have used krill oil in their studies, but most of these studies have been pharmacokinetic studies or safety studies and have not yet demonstrated any human health benefits. So we're very proud to still be able to claim being the only krill oil company that has human health benefits for cardiovascular, women's health, osteoarthritis, and inflammation. I'm going to finish by basically re-highlighting our latest achievements and talking about the Health Canada claims. Obviously, there have already been 2 claims that have been granted for fish oils already in Health Canada as well as in the US. But here in Canada, fish oils were allowed to claim maintaining cardiovascular health as well as reducing triglycerides. What we achieved was the same 2 claims that fish oils are allowed, but we were allowed to claim it at half the dose, for a lower dose for the cardiovascular health and then half the dose for the reduction of triglycerides. What sets us apart, and you can see here in the specific to NQO part, is that we achieved these 2 new claims for cardiovascular health. We are allowed to claim a reduction of LDL cholesterol as well as an increase in HDL cholesterol only by taking 2 soft gels of 500 milligrams a day. That's 1 gram a day. That is really something that is great for any company that's interested in this domain. We also have another family of claims accepted for women's health, which states that it helps relieve symptoms of dysmenorrhea and premenstrual syndrome, and the similar claim helps remove symptoms of PMS. This is specific to NKO. It is cannot be achieved by any other krill oil product or any fish oil